Welcome to ANA community. From the past several videos, we were discussing about the Sapeksha Nidana and Vyavachedaka Nidana and its different models of application for the understanding of Sapeksha Nidana were being discussed. Initially, we have discussed with the hypothetico-deductive model. Afterwards, we have discussed with the pattern identification model. Later, we have discussed with the dual process clinical reasoning model. Today, we are going to discuss about the pathway for clinical reasoning model. When we think about the pathway for clinical reasoning model, first of all, we need to know about what actually is this particular clinical reasoning refers to. When you think about the clinical reasoning, it's a process where we are going to have an interaction with the patient. That means we are going to have the talk with the patient regarding his presenting complaint, etc. And after that, we are going to collect these different informations based on the history as well as physical examination, etc. Plus even the laboratory investigations, we are going to collect these different data. After that, we are going to generate the hypothesis. Later, we are going to test the hypothesis by looking into the the different the steps as such. After that, we are going to make the probable diagnosis and we are going to make the treatment plan based on the information obtained that will be followed. These are the different aspects that we are going to do in cases of clinical reasoning. When you think about the definition, it is nothing but an inferential process that is used by the practitioners to collect to collect the data from history, physical examination, laboratory investigations, etc. After that, we are going to evaluate the data. That means we are going to connect these history, physical examination, laboratory investigations, etc. They are going to collect with one another. After that, we are going to make the judgment about the diagnosis and management of the patient's problems. This is what we can say the clinical reasoning refers to. It is nothing but the sum of these thinking and decision-making processes associated with clinical practice. When you think about the clinical reasoning pathway, it is having 5 different steps: cognition, discipline-specific knowledge base, metacognition, role of patient in the decision-making process, and contextual interaction. These are the 5 different steps of a clinical reasoning pathway. When you think about the first information, that is the first step, that is cognition. That means we are going to identify the pattern recognition in terms of history taking, in terms of physical examination, in terms of laboratory investigations, and in terms of different imaging techniques. We are going to identify the patterns. So that means we are going to have the different examples. For example, chest pain. The person is suffering from the urinary system disease. No chest pain may be possible. Chest pain may be present in case of respiratory diseases. Chest pain may be possible in case of cardiovascular diseases. Chest pain may be possible in case of alimentary canal diseases. Chest pain may be possible in case of musculoskeletal diseases. Chest pain may be possible in case of neurological diseases. The same way, abdominal pain. Abdominal pain in the sense there are basically 9 different regions are being made, such as left hypochondric region, right hypochondric region, epigastric region, left lumbar region, umbilical region, right lumbar region, left iliac fossa, then hypogastric region, and right iliac fossa. Whenever a person is having a presenting complaint of abdominal pain, we need to identify actually which particular location the person is having the pain. Shiraha Shula, in the sense which particular area the person is having the shula, whether is it in the anterior aspect or lateral or posterior aspect. So each of them are having typical, what do you say, that the clinical presentation itself. Sadaha Mutra Pravrutti, wherein the person will be having the burning micturition, which may indicate pitta dominance there. And Shakrit Graha, if the person is not having the appropriate the defecation, or the person may be having the constipation, in that particular situation, we are going to say there may be a possibility of a Vata dosha dominance. So this is in terms of the chest pain as such, in terms of history taking. As far as physical examination are concerned, first and foremost, regarding the tenderness in the second intercostal space on the right side, which is worsening on the change of posture, this is indicative of a musculoskeletal dysfunction. Particularly, there may be a possibility of a costochondritis. Systolic murmur observed in the aortic region may be suggestive of a aortic stenosis. So that means we may able to predict that there may be a possibility of left ventricular dysfunction later, left atrial dysfunction later. So in this way, we have to identify the pattern as such, what actually the person is having there. For example, otherwise, the person may be having the grimacing of the face by holding the head on both the hands. So like that, you are going to say he is having the Shirashchula. First discharge through the urethra or Puya Yukta Mutra. In the sense, the person may be having Pitta dominance, that to Mutra was Rota affliction we can able to predict. Antra Kujana. In case of Udavarta, there may be a possibility of Purusha Vasrota affliction, or there may be a possibility of Annavasrota affliction can be predicted. So, in terms of laboratory investigations as such, increased WBC count may be suggestive of infection happening inside the patient's body, or otherwise decreased hemoglobin percentage with fatigue may suggest the person is having anemia. Excessive pus cells in the urine may suggest urinary tract infection. And as far as imaging techniques are concerned, if you are doing the echocardiogram and if you are observing the compromise in the left ventricular function, probably we may make the diagnosis of a congestive cardiac failure. Or otherwise, you are doing the UST abdomen and you are finding the fatty liver changes in the liver region. We are going to say that the person may be having the cirrhosis of liver or the fatty degeneration of the liver. CT scan head saying that the person is having the headache, etc., having the vomiting, etc. We are observing brain tumor. Definitely, which is considered to be the cognition in terms of the lab imaging techniques are concerned. This is the first step of the pathway for clinical reason. When you think about the second step, that is decision or discipline specific knowledge base. So that means we should be knowing about the overall knowledge regarding the discipline one is practicing. For example, let us say, when you think about the Charaka Samhita itself, more than 3000 Nidana are being mentioned for the different disease processes itself. Let us say, for example, Akshashana. What kind of the rasa intake? For example, if the person is taking more amount of the Katu rasa only, frequently, and proportion of Adhyashana, what kind of the degree of quantity, whether is it in the little quantity or in the abundant quantity. One samosa consumption quantity is something different from 5 samosa consumption, which is even different from the 10 samosa consumption. All of these will have the different impact in the patient's body. That means the degree of dosha vitiation, that to pitta dosha vitiation, may be varying in case of 1 samosa consumption, 5 samosa consumption, or 10 samosa consumption. So, of course, Katu rasa is considered to be responsible for the increase of vata dosha also. In that way, vata or pitta dosha increase may be possible if the person is doing the adhyatana, specifically katu rasa sevana. Further, so you should be in a better position to identify which particular guna is increased in that particular situation. Whether is it in case of vata dosha, there may be a possibility of ruksha guna vriddhi, there may be a possibility of lagu guna vriddhi, there may be a possibility of shita guna vriddhi, there may be a possibility of khara guna vriddhi, sukshma guna vriddhi, or chala guna vriddhi may be possible. Suppose if the person is having pitta dosha vitiation, there may be a possibility of snigdha guna vriddhi or tikshna guna vriddhi, ushna guna vriddhi, lagu guna vriddhi, visra guna vriddhi, or draba guna vriddhi may be possible. So we should be in a better position to identify which particular the guna of the dosha is being increased there. Further, we need to know about the nature of the srotas afflicted. Whether is it bahya srotas is being afflicted or abhyantara srotas is being afflicted. In case of bahya srotas affliction, Ayurveda says 9 bahya srotas are present in males and 12 bahya srotas are present in females. We should be in a better position to identify what is the impact of Nidana Sevana in these bahya srotas, because the exposure of these particular Nidana in one particular bahya srotas may be responsible for the affliction of that particular bahya srotas itself. So that means when the person is having the exposure of dust through the nose, there may be a possibility of affliction of a bahya srotas, that is the nasa itself. You are going to observe that. In the similar fashion, if the rajas or dust is being exposed to the eyes, the person will be having the itching around the eyes or redness of the eyes may be possible. In the similar fashion, if the person is having the dust exposure into the mouth, as such, the person may be having the features of what do you say that the uh, what do you say the irritation in the mouth may be possible, or otherwise the person may be having the irritation in the throat may be possible, etc. That may be observed there. As far as abhyantara srotas are concerned, we have to know about the status of health of pranavaha srotas, annavaha srotas, udakavaha srotas, etc. When you think about the Agni and Ama, so in case of Agni, it is being mentioned that Ushma, Vayu, Kleda, Sneha, Kala, and Samayoga. These are the 6 Ahara Parinamakara Bhava that will be having an impact on the functioning of Agni. So this has to be noted about what kind of the uh, impact is happening. For example, if the person is doing the consumption of food intake during travel, there may be a possibility of Samana Guna Vata. Samana Vata that may be more prominent there. So that means which may have an impact on the Agni Guna Vaishamya. Suppose if the person is taking about more amount of the Katurasa Sevana, that too during the travel, there may be a possibility of the what do you say that Vata Guna or Vata Dosha may be increased to a maximum extent rather than Pitta Dosha increase. Suppose if the person is taking the same amount of the Katurasa or same degree of Katurasa Sevana in a hotel, then there may be a possibility of a Pitta dosha increase rather than Vata dosha increase. Whereas status of Ama, when you think about the status of Ama, what we can say that is the macromolecules, we need to know about whether they are present in the alimentary canal or whether they are present in the intravascular compartment or whether they are present in the interstitial compartment or whether they are present in the intracellular compartment. So to know about the, what do you say that the lakshanas present of the ama present in the body. Further, you need to know about the different diseases also. For example, Atisara, Gudena Atidrava Pravrittihi. So that means the person will be having the excessive movement of the liquid stools or unformed stools from the anus. That is what we can say Atisara. Jara, the person will be having the santapa of Deha and Manas itself. Whereas prameha, the person will be having the frequent micturition. That is, varam varam mutratyagam karoti, yasmin roge sa prameha. prakarshena prabhutam prachuram varam varam mutratyagam karoti yasmin roge saprameha. When the person is having increased frequency of micturition, then we are going to make the diagnosis of prameha. So like that, whenever if you are entering into the bedside or entering into your OPD as such, you need to know about the different disease manifestations regarding their different presenting complaints, etc. has to be known. So this is what we can say. Whenever if you are having an interaction, we should be knowing about the discipline specific knowledge base. We have to broaden our this particular knowledge base. Next step, that is the metacognition. What is the patient's perception of the illness? So when you think about that, you need to know about the duration of the symptoms or dominance of the symptoms in particular times of the day. Whether is it present in the morning, or is it present in the noon, or whether is it present at the evening time. So all they are suggestive of the different dosha increase itself. Let us say, for example, if the person is taking the adhyasana from the past 4 days, we need to know about the exact sequence of appearance of symptoms. If the person is distension of the abdomen, then we are going to say there may be a possibility of Vata dosha increase. Or otherwise, if the person is having burning sensation in the epigastrium, there may be a possibility of Pitta dosha increase. If the person is having the burning sensation in the chest or throat, we are going to say the person is having Pitta dosha increase. Surya erectation, we are going to say the person is having the Pitta dosha increase. So that means we need to know about the exact duration of the exposure of Nidana Sevanam, and we need to know about what actually Lakshana they are being producing. So that has to be linked properly. Let us say one more example. If the person is doing the Vyayama for 30 minutes from the past 2 days, we need to know about what kind of the Lakshanas they are being producing. If the person is breathing discomfort, which may indicate the person is having the Vata dosha increase. If the person is having the coughing, probably we are going to say probably there may be a possibility of exposure of that cold air through the mouth or nose, which is responsible for the coughing as such. Fatigue, which may indicate the person is doing excessive amount of vyayama. Or muscle cramps, specifically see in the calf muscles, which is indicative of excessive amount of vyayama. Sweating in the forehead, etc., that may suggest there may be a possibility of pitta dosha increase as such, or otherwise we are going to say increased metabolic processes are happening inside the body. So like that, what kind of the presenting complaint the person is having, that has to be analyzed, and that should be discussed with the patient in making the decision making process. For example, if the person is having the pain in the joint, the two of pricking type, which is indicative of the person is having the Vata dosha increase in the patient at that particular time period. When there is Vata dosha increase, the earliest management should be there to decrease the excessive Vata dosha present inside the body. That means what kind of the guna is going to get increased. For that, you have to give the appropriate treatment itself. Suppose if the person is having Ruksha guna increase, if you are giving the Chala guna type of the treatment, which will not help. If the Ruksha guna is increased, then you are supposed to give Iddha guna itself. If the person is doing the Ratri Jagarana, then there may be a possibility of Vata dosha increase. It is being said that when the person is doing the Ratri Jagarana, there may be a possibility of Ruksha Guna Vriddhi. When there is Ruksha Guna Vriddhi, that too in case of Ratri Jagarana, if you give simply the Snigdha type of the line of treatment, then it will not help. Ratri Jagarana has to be supplemented with Divaswapna. That too, half amount of the Ratri Jagarana. Suppose if the person is doing the Ratri Jagarana of 3 hours, the Divaswapna should be done, that too for 1.5 hours. That too before taking the breakfast itself. This is what we can say the line of treatment has to be planned along with the patient itself, because these are the information the patients will not be knowing. So in that particular situation, you are the person who are going to inform all these different aspects, how that has to be planned. Suppose if the person is having sore irritation in the throat, which is indicative of pitta dosha increase, that too which is specifically seen in alimentary canal itself. So that means you have to give the line of treatment specifically concentrating upon the pitta dosha prakopa itself. Suppose if the person is having white sputum in large amount that to observed after every bout of coughing, which is indicative of a kapha dosha vitiation to the maximum extent. That means we have to give the line of treatment for kapha dosha prakopa. Maybe ushna, or maybe the laghu, etc. You have to. So when you think about the further, these informations will be helpful in knowing about the do's and don'ts. Suppose if the person is having Vata dosha increase, you are going to avoid व्यायामात् अपतर्पणात् प्रपतनात् भंगात् क्षयात् जागरात् वेगानां च विधारणात् अतिशुचः इत्यादि तित्रासतः रूक्षक्षोभकषाय तिक्तकटुकैरेभिः प्रकोपं व्रजेत् वायुर्वारिधरागमे परिणते चान्यपराह्ने अपि च. These are the things that we are going to avoid if the person is having Vata dosha increase. If there is Pitta dosha increase, Katvam doshna vidahi tikshna lavana krodho upavasa tapastri samparkatilatasi tadisura shuktara naladibhi भुक्ते जीर्णते भोजने च शरदि ग्रीष्मस्थिति प्राणिनां मध्याह्ने तथा अर्धरात्रि समय पित्तं प्रकोपं व्रजेत्. We are going to avoid these in case of pitta dosha vitiation. गुरु मधुर रसात् स्तिग्ध दुग्धेक्षु भक्ष्य द्रवदधि दिननिद्रा उपसर्पिष्प्रपूरैः तुहिन पतन काले श्लेष्मण संप्रकोपः प्रभवति दिवसादौ भुक्तमात्रे वसन्ते. These are the kapha dosha vitiating factors that has to be avoided if you are observing kapha dosha increase or kapha dosha abnormal increase or kapha dosha vitiation in the patient. So like that, further, depending upon the distribution of the symptoms in the patient, whether it is localized or generalized. If it is localized, then mild form of treatment may be necessary. If it is generalized, severe or the form of treatment is essential, or treatment for longer duration may be essential. So further, when to plan the Panchakarma line of treatment, how we are going to decide Bahudoshavastha or Madhyamadoshavastha, Alpadoshavastha, and whether the consumption of only oral medications are sufficient or not, or when to plan the Panchakarma line of treatment, that has to be discussed along with the patient so that the person or the patient will be getting the maximum benefits. As far as the fifth step, that is contextual interaction, are concerned, first of all, we need to know about the Lakshana. Based on that, we are going to say the person is which particular dosha is increased in the body. For example, the person is having the Karshya, Karshni, Ushna Kamitva, Kampa, Anaha, Shakrigrahan, Bala Nidrendriya, Brahmshaklapa, Brahmadinata. We are going to say the person is having the Vata dosha vitiation there. So what kind of the time period the person is having the aggravation of the symptom? For example, if the person is having the aggravation of the pain while doing the walking for longer amount of time, which is suggestive of the Vata dosha increase is the naturally being observed at that particular time period. Or otherwise, if the person is going for the evening walk for up to 2 hours or so, then we are going to say there may be a possibility of abnormal Vata dosha increase. Further, which particular guna is increased in the patient? So we, after looking into the elaborate Nidana analysis, we are going to say the person is having this particular guna is increased in the patient. So that means these are the possible things that has to be avoided. Suppose the person is doing more amount of the running, initially we are going to observe chala guna increase. So that means immediately we have to give little bit amount of rest as such that chala guna can be restored normally. And what kind of dysrothas is being afflicted, that has to be known. So suppose if the person is having the Atisrishtam Adibaddham Kupitam Alpalvam Abhishnam Shabdasulam Uchvasandam Drishtva, if these are the Lakshana are being observed, then we are going to say the person is having Pranabhasruta Dushti. Suppose if the person is having अतिसृष्टमति बद्धं प्रकुपितमल्पाल्पम् अभीक्ष्णं वा बहलं सशूलं मुत्रयन्तं दृष्ट्वा. In that particular situation, we are going to see the person is having mutrabasrota dushti. So like that has to be known. Regarding the status of Agni and Ama, whether the person is having the Udgara Shuddhiritsaha Vegotsarga Yathochita Lagodakshit Pipasa Jirnaharasya Lakshanam. If the person is having the Jirnahara Lakshana at appropriate time period, then we are in a better position to make the proper explanation to the patient itself. Further, as far as timeline of the symptoms are concerned, what kind of the symptoms the person is having. Suppose if the person is having the exposure into the nose, the person may not get the features of what you say that the stomach dysfunction. Initially, he will be having the symptoms related to nose and nasal cavity only. If the person is having the exposure of the etiological factor into the eyes, the person will be having the lakshana specifically related to eyes first. This may be followed by other clinical features. So like that, we have to give the contextual explanation to the patient itself so that the maximum benefit can be achieved by the patient. So the take-home messages from today's discussion are this: the pathway to clinical reasoning model. It's another way of working on Sarpeksha Nidana, Vyavchedaka Nidana. This particular model requires active involvement of the physician also, and patient also, and patient's relative also, in cases of emergency. As far as 5 steps of this clinical pathway for clinical reasoning are cognition, discipline-specific knowledge base, metacognition role of the patient in decision-making process, that is the role of patient in decision-making process, and contextual interaction. So these are the 5 steps. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message, or huge movement among the Ayurveda learners, or among the Ayurveda enthusiasts, or among the Roga Nidana learners. We can able to build huge movement. That's all for today. In the next video, we are going to discuss about the example of this kind of the model. That is, example of a pathway for clinical reasoning will be discussed in the next video. Thank you.